An alginate impression is what you use majority of the time. Like there's heavy body, light body, but as a dental assistant, alginate impressions are what you're going to be taking to make models of your patient's teeth. So let's go over how I use an alginator to make that happen. For just showing you guys how to use the alginator, I'm only mixing 1 scoop of powder. However, when you start to go to 2 scoops or 3 scoops, things get a little trickier. Sometimes alginate gets on the wall, just as you're learning. So be prepared to wait till it gets hard and scrape it off later. Okay, so let's mix some alginate. This is the alginator. Mine clearly has seen better days. You will need 1 mixing spatula, 1 measuring cup, your alginate, and a mixing bowl. So in order to secure the bowl to the machine, you'll place here and secure it with a small movement. Bowl is now secure. We are going to open up our alginate. Inside we have our scoop. You'll want to grab the material, shake off the excess. And I like to tap like so, and you have a perfect scoop. Then you'll place your scoop into your bowl and just make sure you get it all out. Now about that water temperature. You want to make sure the water's not too hot or too cold. If you can get as close as possible to room temperature, you'll get a much better mix. So 1 scoop of water, 1 scoop, 1 water. So when I first start mixing my alginate, I start on the low setting just until I get the powder and water mixed so that I don't have powder flying everywhere. Once I get that consistently mixed, I'll turn her up to high. Incorporate. So what I'm going to do is take the blade and run from the bottom of the bowl up. And I'm applying a little bit of pressure on it so that I can flatten some of the material around the sides of the bowl so I get a better mix to the alginate. And save yourself a lot of heartache if on the last scoop, you drag the blade from the bottom to the top of the bowl, cleaning out all the excess. Plus, you're not wasting any product. Just as a side note, whether you're using the alginator or not, when you fill your impression tray, you should have a little bit left over. Go ahead and keep it on the blade, especially if you're passing it to your dentist, or use it to just swipe around the occlusal and the facial and the buccal of the teeth before you place the impression tray in. I tell you what, it's gonna save you a lot of issues with bubbles and voids. using the alginator takes some practice, right? You get that muscle memory, you'll get the process put down. Don't let it stress you out. I have seen so many dental assistants completely avoid the alginator like it's the plague because they make a mess or the bowl comes off or some catastrophe is attached to it, like they mix too long, right? And next thing you know, the alginate set up by the time you get it in the patient's mouth. So practice, practice, practice. If you need to, ask your doc to buy you a cheaper brand of alginate and practice when the patients aren't there. It's a great way to learn the machine, get comfortable with it, and be a rock star.